When it comes to data sharing, there are lots of different ways this can be done, and a patient can consent or dissent to any of these. Ordinarily, recording a patient's preference to different types of sharing is controlled from different areas of the System 1 record and can sometimes become confusing. With Ardens, you have a simple template where you can control all sharing preferences, and in order to access it, you just click the blue hand icon that appears under any patient's name and address. And this opens the Sharing Records template. On here, one of the first things you have is a data sharing consent form. This is a simple form that can be printed off, and the patient can then make their choices. They can tick the boxes for their consents, sign at the bottom, and this can then be scanned into the patient's record for reference later. You can record that confidentiality has been discussed and the patient's been signposted to a privacy notice, that any sharing decisions have been made in the patient's best interest with a link to the decisions and mental capacity template, and any consent given to child proxy access. You then have a link to the System 1 sharing in and out screen. This is where I can record the patient's preferences to the enhanced data sharing model within System 1 or EDSM. Here you have a preference for sharing out and for sharing in. So for sharing out, answering yes is recording that the patient consents to information recorded at this service is added to their shared record, which may be visible to other healthcare providers that have registered the patient for care that also use System 1. And the information will only be visible if the patient consents to that service sharing in. And for sharing in, recording consent given is recording that the patient consents to this service being able to view information recorded by other healthcare providers that have this patient registered for care. It's often easier to view these preferences as a diagram. So here's the patient's shared record. When registering with a GP practice, they answer yes to sharing in. That means anything already recorded in the shared record can be visible by staff at the GP practice. They also consent to sharing out. That means any information recorded at the GP practice will be put into the shared record, meaning it will be visible by other services that register the patient for care. The patient then registers with a community service. They consent to sharing out. That means anything recorded by the community service will be put into the shared record and then could be viewed by the GP practice. And they dissent to sharing in. That means any information recorded by the GP practice would not be visible by the community service. So clicking OK here records the preferences, and you're able to view the patient's preferences in the window at the bottom of the Sharing Records template. Now the next options control SCR, or the Summary Care Record, and the first one here is the SCR core dataset. The Summary Care Record is an electronic record of important patient information that's created from the GP medical records and uploaded to the spine. It can be seen and used by any authorised staff from other healthcare providers, regardless of the clinical system that they're using. It's especially useful if a patient presents in hospital. A consultant can view a basic summary of their medical information. The core dataset is a basic summary. It includes the current medication, any allergies or details of any previous bad reactions to medicines, and the name, address and date of birth, along with the NHS number of the patient. Any patient registered with an NHS number will automatically get a summary care record with a core dataset, unless they dissent to the service. You can record dissent here, and you can also record express consent, although assumed consent is given for any patient that doesn't have this. The next option here is the Summary Care Record Additional Dataset, and this is where you can record that the patient consents to more information being uploaded to their SCR. This can include significant medical history, DNA CPR status, treatment escalation plan, and it's especially useful for patients that have very complex care needs or that are on the end-of-life or palliative care registers. The next options that you have are around third-party consent. It's a useful area to be able to record that consent has been given by the patient to share information with their spouse or a family member. Here I'm going to record the patient's consented to sharing information with their wife. Here I also have an optional consent form that the patient can fill out and sign, and then can be scanned into the patient's record. You also have an area to record anyone who the patient specifically declined consent to share with. You then have a section labelled Other. This is where you can record consents to any of the national audits, like the diabetes audit, and also any local shared records, such as the Hampshire Healthcare record. Then have two useful links to other templates. So the Future Care Planning link, which is where you can record lots of information that will be uploaded to the Summary Care Record additional data set, such as a DNA CPR status or a treatment escalation plan, and also a link to the System Online access template where you can register or adjust any preferences for their System Online account. I can then OK at the bottom to save all of this information. All of this will be visible in the journal, and also by clicking the blue hand icon again, I can see any information that's previously been recorded in the useful window at the bottom.